So the next topic is ulnar nerve. So ulnar nerve supply the in flexor in forearm it supply the flexor carpi ulnaris. We have already discussed in the median nerve, and it supply the flexor digitorum profundus medial aspect. So these two muscles are supplied in the forearm by the ulnar nerve. In the hand, it goes forward on the medial aspect and it supply the hypothenar muscles and intrinsic muscles of hand. Okay. In hand, it supplies the hypothenar, third and fourth lumbricals, and dorsal interossei and adductor pollicis. Okay. So I have already told you in the median nerve also that most of the muscles of hand is supplied by the ulnar nerve, and fingers and hand is used in playing music. So that's why it is known as musician nerve. And forearm muscles is used in lifting heavy weights. So that's why it is known as levator nerve. Median nerve is known as levator nerve. Okay. So ulnar nerve supply the hypothenar muscles, third and fourth lumbricals, dorsal interossei, adductor pollicis. In sensory, it supply the medial and 1.5 fingers. Okay. And it supply the palmar interossei. Palmar interossei action is adduction. So if this action is lost, then card test is positive. Okay. Patient is not able to hold the card by the help of his fingers. Okay. Injury leads to partial claw hand. Okay. And there are 4 tests: book test, card test, Igawa test, Froment sign. These are all positive. So you can see this is Igawa test. So patient is asked to move the middle finger. Okay. So because the dorsal interossei action is lost, so patient is not able to move. That is known as Igawa test. Froment sign, you can see normally it holds the card, but due to action of flexor pollicis brevis, Froment sign is positive in case of ulnar nerve injury. Okay. Book test and card test. So because patient is not able to hold the card because of loss of action of palmar and dorsal interossei. So B, C, D, E, F. B, C, D, E, F, and D is B is for book test, C is for card test, D you have to skip, E is for Igawa test, and F is for Froment sign. And the splint we use is knuckle bundle splint. So these are all tests for ulnar nerve injury. Okay, thank you.